The federal government about 2 weeks ago enacted into law sweeping health care reform. NAR, prior to that, for years, had been working with members of Congress on its own very targeted, limited, market-based approach to reforms for small businesses and self-employed individuals. When Congress undertook its sweeping reform, events overtook NAR's efforts, but much of the work that NAR had put forth in its effort to get better insurance options available for small business and the self-employed was factored into these sweeping reforms.
Our members are pretty much right on target with the demographic that Congress had in mind. You know, either individuals who have no employer-provided coverage through their jobs, or self-employed individuals, you know, both of which lines up with our membership, or small employers who, like those self-employed individuals and individuals, find it difficult to find affordable coverage in the existing state-regulated insurance markets that we've had to date.
Walk us through the 4 or 5 provisions in this giant act that realtors are going to care the most about.
Okay, first of all, what the bill does is to create much larger insurance pools. Right now, individuals obtain coverage in the individual market, small employers get it in the small group market. What the bill does is it said, no, we're not going to do that anymore. You're going to pool everyone into a single pool. Now, in the initial going, there's going to be an individual market, and there's going to be a small business exchange. And those are simply the marketplaces that exist for shopping for coverage in the individual or in the small group market. So what we've been looking for, which is this larger aggregate pooling tool, is actually what this bill does create. So you're going to have larger pools of individuals, which means that you've got more folks to spread the risks and the claims over. That means lower per capita costs. You've also got less overhead because you've got a larger pool. So again, your per capita costs are lower. And so that pooling mechanism, that exchange, really is something that's very much important to realtors because it has an impact on the pricing in the aggregate. Second of all, the bill creates rules about how insurers can treat individuals. First of all, it says that no insurer can turn an applicant down. It's what's called a guaranteed issue. Second of all, it says that there are limits in terms of what the insurers can use to price the policy. So right now in most states, if you've filed health claims in the past, that will lead to a higher rate. If you're older, that leads to a higher rate. If you have pre-existing conditions, that can lead to a higher rate. What this bill does is to say that, no, you can't rate people based on some of these factors that have been allowed in the past. And the 4 factors that you can rate someone's policy, price their policy, are 1, what type of policy do they buy? Is it an individual or a family policy or a parent-child or a couple policy? What type of policy do you buy in terms of the coverages? Not so much the conditions that are covered, but in terms of its deductible and its out-of-pocket expenses. It allows the insurers to take into consideration where you live, because obviously, getting health care coverage in Merced, California, is much different than, say, Midtown Manhattan. And finally, they can take age into consideration, but it's a very limited ratio. Right now, there's no bounds on how much you can be charged based on age in many states. It can be the ratio can be as much as 1 to 35. And that means basically that the youngest person would pay, say $100, and the oldest person would pay $3,500. Mm-hmm. Well, in this bill, it limits it to a 1 to 3 ratio, which means for our members, that's going to be a positive change. What it doesn't do, it doesn't allow them to charge on the basis of gender. So our female realtor population is going to see some changes there. It doesn't allow you to price the policy based on pre-existing conditions or past health claims. The exchange also gives folks another advantage, and that is that it gives them one place to go to shop for coverage. Right now, if you go looking for health insurance, you've got a lot of options. You can go online and see what the insurance companies are offering there individually. You can go to websites like eHealth Insurance that have some offerings in some marketplaces. You can go talk to individual insurance brokers. But there's no one place where you can go to find out all of what's available to you. And the exchange is going to be that one-stop shop. Now, for our self-employed realtors, there's an added advantage. And that is, I talked about there being two exchanges in the very beginning, an individual pool and then a small group pool. Under the terms of the bill as it was approved, the self-employed individual, the independent contractor, the freelance person, can shop in both marketplaces.
So about a quarter of NER members right now don't have health insurance. So, but that means 75% of NER members do have health
coverage.
insurance. So let's say I have health insurance, I'm happy with it. What's in it for me?
First of all, if you have coverage and you like it, there's nothing that says that you can't keep that policy. It will be considered credible coverage, or the required coverages that everyone will have to have. It'll meet those criteria, so you can keep it. Now, obviously, there are some caveats to that, in the sense that if you've got coverage through a spouse's employer or a second job that you've got, you're going to be dependent upon what that employer chooses to do with their policy. If you are in the individual market and you're buying directly from a company, that company may choose not to offer that product, moving forward.
So, one of the main points that you made is that the pools are going to get larger, and we as insureds, we benefit from that, because the larger the pool, as you said, the more cost efficiencies, and so theoretically the individual premium should come down because risk is spread. So that,
or at least not rise as quickly, because you've got a larger pool to spread that increase over.
okay, so hopefully our premiums won't rise as quickly as they would otherwise do. What's the negative of that? I mean, how do they get those larger pools?
What they've included in the bill are an individual mandate, and that individual mandate basically says, with certain exceptions, everyone has a responsibility to have health coverage of some sort or another. Now, that could be coverage through an employer, through a spouse who's employed, through military service, through retiree benefits, through the SCHIP, the state's children's health insurance programs, through Medicare, through Medicaid. Basically, they don't tell you where you have to go, they just say you need to have coverage. And that's called an individual mandate. You need that for a couple of reasons. One, you want the biggest pool, I've talked about that. But two, you don't want people gaming the system. You don't want people staying out of the marketplace and not participating until they get to a point where they know they need the services. At the same time that there is this individual mandate, there's a recognition that just because you put these reforms in place, there's still going to be some folks who simply don't have the disposable income to afford that extra insurance premium. So what the bill says is that if the most affordable coverage available to you through the exchange premium constitutes more than 9.5% of your income, you can be exempted from the mandate. There are religious exemptions. But the other thing the bill does is it creates a series of affordability credits that actually will help folks who are eligible pay for their health coverage. And the way this works is that if you're a household, let's say a household of 4, and your income is 400% or less of the federal poverty level, less than $88,000, you would be eligible for some amount of affordability credit. For an individual, that 400% translates into I think it's $43,000. That's a pretty good chunk of the population, and obviously that's one reason why the bill has the price tag that it does. On the employer side, there's an employer responsibility requirement, and what it says is that employers have a responsibility to provide coverage to their employees. If they don't provide coverage and their employees go to the exchange and received an affordability credit, then that employer would have to contribute towards the cost of that credit. So there is a downside there for companies that, don't provide coverage. Like everything, there are limits though to that rule. And the way that the bill is structured is it says that if you are an employer with 50 or fewer employees, you're not subject to this employer responsibility mandate. There are tax credits for small employers, very small employers. So if you have 25 or fewer employees, and your average wage is $40,000 or less, you would be eligible for tax credits.
So the typical real estate brokerage is probably fewer than 50 employees, is that right?
Our statistics would seem to indicate that, that the average real estate firm actually has 5 or fewer affiliated agents, and if you translate that into, full-time employees, truly salaried, that firm is likely not to have more than 1 or 2 salaried employees.
What about time frame? So this isn't going to turn around tomorrow and suddenly everything is going to be in effect.
Right.
What happens when?
Okay, that's important to know. What Congress did was they phased in some of these proposals. So, for example, the individual mandate and the employer mandate do not take effect until 2014. For the exchanges to be put in place, those will open up in 2014 also. And the individual tax credits or affordability credits will be available in 2014 when the exchanges open. If you're a small employer, though, there are actually tax credits that are available to you starting this year for tax year 2010 if you are the parent of a young adult who is 26 or younger. They can stay on your family health care plan. So that's one thing that will start almost immediately. One of the pre-existing condition exclusion rules that insurers have used to deny coverage to children who have pre-existing conditions, that's banned later on this year. And there's some Medicare donut hole fixes that start to get phased in beginning later on this year. But in terms of coverage through the exchanges and the full implementation, we're talking 2014.